Hello and welcome to Your Home Medical Provider. In this video, we will be discussing lowering blood pressure without the use of medications. We'll be going over the healthy range of your blood pressure, risks of high blood pressure, how to check your blood pressure at home, increased risk factors for high blood pressure, and practices that you can do to lower your blood pressure without the use of medication. The first number of the blood pressure, or the systolic blood pressure, should be in the 110 to 130 range. The lower number, or the diastolic blood pressure, should be in the 60 to 90 range. If you are checking blood pressures at home and either the systolic or diastolic numbers are too high or too low, it will be best to be evaluated by a medical provider. Blood pressure that is too high can lead to damage to the blood vessels, much like a tire that is filled with too much air pressure. The smallest blood vessels are going to be the most fragile and are at the highest risk of damage due to elevated blood pressure. Elevated blood pressure puts people at increased risk of stroke, cardiovascular disease, and kidney disease. Blood pressure that is too low can lead to a lightheaded sensation or, in extreme cases, loss of consciousness. To avoid complication of high blood pressure, people with elevated blood pressure, otherwise known as hypertension or borderline hypertension, should check blood pressures at home to make sure that a medication isn't necessary, but also to establish a baseline of blood pressures so that they are not put on blood pressure medication unnecessarily should there be an elevated blood pressure in a medical setting due to white coat syndrome or just being nervous in a medical setting. When checking blood pressure at home, we want to make sure that your blood pressure is within the normal range at rest. Checking blood pressure in a seated position with feet flat on the floor is the best position for checking blood pressure. It is recommended to be in the seated position, taking slow, deep breaths for 2 to 5 minutes prior to checking your blood pressure. It is also recommended to check blood pressure during a time of day that you are most calm. This typically includes right after waking up in the morning or before going to bed at night. Using an arm cuff blood pressure machine is typically more accurate than the wrist cuff blood pressure machine as well. Risk factors that increase the chances of high blood pressure include increasing age, overweight, smoking history, diets high in sodium or salt, increased alcohol consumption, increased stress, family history of high blood pressure, and people that don't get enough exercise. Treating blood pressure without use of medication includes weight loss for those of us who are overweight or obese, quitting smoking for those of us who do smoke, limiting alcohol to no more than 2 drinks daily on average for men or 1 drink daily on average for women, though the closer you can get to no alcohol, the better. Limiting salt in diets to below 2,300 milligrams or 1 teaspoon, and increasing exercise to over 150 minutes of cardiovascular exercise per week. Stress reduction techniques such as regular meditation or mindfulness practices are also helpful in lowering the blood pressure. If you're already taking blood pressure medication, doing the practices listed here can help to avoid needing more medication in the future or lowering your dose of blood pressure medication that you are already on. If you find that doing these practices listed here is not effective in lowering your blood pressure or doesn't lower your blood pressure enough to get below the 130/90 range that we discussed earlier, seeing a medical provider for further evaluation and possible medication treatment would be recommended to avoid the health complications that come along with high blood pressure. I hope you found this video helpful in lowering your blood pressure without the use of medications. Please like and subscribe for more medical videos like this. Thank you.